Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner is evaluating a family at the request of County Social Services. A mother, father, 8-year-old, and 2-year-old are present for the evaluation. The NP notes that the 2-year-old clings excessively to the parents despite the fact that the parents do not seem to be particularly responsive to the child's caution. The 2-year-old does not exhibit typical curiosity about his new environment and does not express any curiosity about the psychiatric mental health nurse practitioner. These behaviors are consistent with A. Separation anxiety disorder, B. Normal behavior, C. Autism spectrum disorder, or D. Insecure-ambivalent attachment. So this really is a diagnosis question. You are expected to know some of the key elements of common diagnoses in this circumstance. And, even if pediatrics is not your strong suit, or maybe you don't have children, or you just don't think much about pediatric theory, when you look at the answer choices and you think, oh boy, I'm not sure what's going on here, one of the things that you can ask yourself is, does it seem normal? Does it seem like normal behavior? If you have a mother and a father and 2 children, and they're in a new environment, and the parents are right there, does it seem normal for the 2-year-old to just hang by the parents and not explore? And I can tell you the answer is no. Now, if the parents weren't there, they might take a moment or two and then get ambitious, but it is the nature of the 2-year-old to be off exploring. Remember, one of the things about growth and development, not just in terms of mental health, but growth and development in general, when it comes to, infants and toddlers and preschoolers, etc., when they start being able to do something, they want to do it. And, a 2-year-old is at that place where they are just able to run around, look at stuff, open things, pick stuff up, touch. They can usually communicate with some level of word understanding. So usually in a new environment, they're all over it. So even if you're not sure, for that reason alone, you can probably eliminate normal behavior. So what do you think is going on? Well, if you know the answer, you know it, and then it's easy. But if you don't know the answer and PEDS isn't your strong suit, let's think about this for a minute. Separation anxiety disorder. Separation anxiety disorder might be something that would come to mind if you were, if you're not sure and you've never worked with kids and you're just kind of grasping in the dark here and you want to be able to reason through it. You might think, oh, the child just stays by its parent and it doesn't want to go anywhere or it doesn't want to do anything. It clings to the parent. I can understand that thought process, but remember that separation anxiety disorder has specific criteria. It's usually of a minimum of 6 months in duration. And when the parent is there, it's not so much clinging physically to the parent, it's not wanting to be away from the parent. So if you see that the child is fine until the parent leaves the room, or you try to pick up the child and take it away, that's when you might expect to see some unusual behaviors related to separation anxiety disorder. Autism spectrum disorder, actually the child tends to be less clingy to anyone. So clinging to anyone, even a parent, is not typical. What we've got here is D, insecure-ambivalent attachment. This behavior described in the question is actually classic insecure-ambivalent. The child clings to inconsistent parents. Inconsistent parents. That's how you can remember the ambivalent piece, insecure-ambivalent. There's different types of insecure attachment dysfunction. Insecure avoidant children tend to avoid direct contact with the parents. They actually tend not to be so clingy. And insecure disorganized children more often display bizarre behavior, like they may be overly eager to separate off, interact with people they don't know, and things of that nature. But the insecure ambivalent child tends to cling to the parent, even if the parent doesn't overtly appear to reciprocate the behavior. So to go through these answer choices, this behavior again is classic insecure ambivalent, which the child clings to inconsistent parents. Conversely, in insecure avoidant children, they tend to avoid direct contact with the parents, whereas insecure disorganized children just tend to display bizarre behavior. Separation anxiety, like I said, it's more evident when the parent is not visible, or you try to take the child away from the visual view of the parents. And this is not normal behavior. It doesn't necessarily mean pathology. I mean, it doesn't mean there is a diagnostable, is that a word? It doesn't mean there is a disorder, but it's not typical behavior for a 2-year-old to cling to a parent like that. 2-year-olds are much more likely to aggressively explore the environment. And finally, autism spectrum disorder doesn't typically demonstrate strong attachment to parents or anyone for that matter.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.